The IMPLATE Wrist Arthrodesis Nail by Skeletal Dynamics. Make an 8 cm to 10 cm longitudinal incision centered over Lister's tubercle, exposing the extensor retinaculum. Open the sheath of the extensor pollicis longus and reflect the tendon radially. Expose and release the second and fourth extensor compartments. If desired, prepare flaps to reconstruct the fourth compartment. Open the dorsal wrist capsule in an H fashion. Once open, reposition the retractors to the plane below the retinacular flaps. Position the wrist in flexion, allowing access to the radiocarpal and intercarpal joints for complete decortication of the articular surfaces. Mark the distal flare on the dorsal surface of the capitate in line with the third metacarpal. Using the minimum gap gauge, confirm that there is sufficient space between the metacarpal entry point and the radius. Open the medullary canal of the third metacarpal by inserting the awl aimed towards the head. Fluoroscopic imaging is helpful at this step. Using a 1.5 mm K-wire as a probe, insert it through the medullary canal to locate the head of the metacarpal. Fluoroscopic imaging is required to confirm the proper placement of the K-wire. Ream over the 1.5 mm K-wire using metacarpal reamer 1 to the proper depth. Then remove the K-wire and continue reaming to the proper diameter. Insert the awl into the medullary canal up to the line marked M. While rotating the handle, this will shape the capitate so it can accept the metacarpal nail's flared end. Secure the metacarpal nail to the drill guide using the lock screw. Insert the metacarpal nail into the medullary canal until the drill guide seats flush against the capitate. Insert the drill sleeve through the distal slot of the drill guide until flush against the skin. Mark the skin where the drill sleeve makes contact, then remove it. Be sure to dissect down to the bony surface, reflecting all soft tissues out of the way. Reinsert the drill sleeve through the distal slot until flush against the bone. Drill through the near cortex using the 3.0 mm unicortical drill bit. Insert the depth gauge through the drill sleeve until the far cortex is reached to determine the appropriate screw length. If between screw lengths, choose the shorter screw option. Secure the metacarpal nail using the appropriate length 2.8 mm unicortical screw. Confirm that the unicortical screw is fully tightened and flush to the bony surface using fluoroscopic imaging. The IMPLATE system offers connectors in 4 angle variations and in 3 lengths. Final connector length, angle, and rotation adjustments can be made during final hand positioning. Remove the drill guide and attach a preliminary length and angle of connector. Place the wrist in the desired final position and mark the connector's contact point on the articular surface of the radius. This location marks the entry point for the radial nail. Remove the connector and open the medullary canal using the awl. Confirm proper placement of the awl using fluoroscopic imaging. Prepare the medullary canal using the 2 radial rasps. The depth marks on the rasps determine the appropriate nail length. Rasp to S, use the short radial nail. Rasp to L, use the long radial nail. Fluoroscopic imaging is helpful during this step. Insert the awl into the medullary canal up to the line marked R. This will shape the radius so it can accept the radial nail's flared end. Secure the radial nail to the drill guide using the lock screw. Be sure to fully tighten the lock screw. Insert the radial nail into the medullary canal until the drill guide seats flush against the radius. Provisionally secure the radial nail to the radius by inserting a 1.5 mm K-wire through the K-wire hole on the drill guide. Confirm that the K-wire has bicortical contact using fluoroscopic imaging. Insert the drill sleeve through a slot on the drill guide until flush against the bone. Advance the 3.0 mm drill bit through the near cortex until the mechanical stop of the drill guide is reached. Insert the depth gauge through the drill sleeve until the far cortex is reached to determine the appropriate screw length. If between screw lengths, choose the shorter screw option. Loosely thread the appropriate length 2.8 millimeter unicortical screw into the nail. Repeat previous steps to prepare the remaining radial screw hole or holes. Remove the drill guide, leaving the K-wire in place. Select the connector length to allow for full seating of the splines after construct assembly. Rotational adjustments should be made between the connector and the radial nail. Angled connectors allow for adjustments of wrist flexion, extension, and radial ulnar deviation. Lock the construct using a set screw in each nail. Remove the 1.5 millimeter K-wire to allow for distraction or compression of the fusion site. Apply bone graft as needed. After achieving optimal compression or distraction, fully tighten the 2.8 millimeter unicortical screws to lock your position. When desired results are achieved, confirm that all screws have been fully tightened. Close the dorsal capsule, then repair the extensor retinaculum as necessary. Repair the remaining soft tissues as needed, and then close the incision. Confirm final hand positioning. The IMPLATE Wrist Arthrodesis Nail by Skeletal Dynamics.